Hi, I'm Kevon Owen. This is Lowe. He's a PA, and sometimes people come and see me and they've started taking their antidepressant medication or other like Psych Meds, and they're starting to feel better, so they stop taking it. Paul, what do you say to that?
Man, that is a incredibly common problem. We got to remember we're taking these medications to help us not feel depressed, and when they're working, you don't feel depressed. And the natural progression of that thought is, I don't need it anymore. But really, that means the medicine's working, and we really need to stick with it. There's nothing better than staying with a therapy that is working.
There's this thing that's happening with your brain, is it's rewiring. You get on a good SSRI, SNRI, something along those lines, and your brain is going to start creating new pathways, and that takes time because you didn't get depressed in a short amount of time. In fact, most of us, it took a long time to get there. And so you want to give meds a chance to kind of start rewiring, reworking that, and get you going in the right direction.
Absolutely. I mean, if we were treating strep throat, I'd give you medicine for a week and you'd feel better in less than a week probably. But when we're talking about SSRIs and depression, he's absolutely right. We didn't get there overnight, and it's going to take quite some time to get out of there. And what feels like quite some time to us is really actually a short amount of time when we're talking about depression, anxiety, and things like that.
Sometimes people feel like this is a life sentence. A lot of times, most of the time, you're not going to be on a med the rest of your life. But I would say you want to plan on it being a fairly good amount of time. As if you were going to start a diet, you wouldn't give it a month and then stop doing it. No, if you worked it for an appropriate amount of time, you'd get great kind of results. So, I don't know, it depends on the med, it depends on the person prescribing it, but I always tell people, plan for somewhere between 12 and 15 months on a med at minimum if you're going to get into this, because, well, psych meds take time and you want it to really build up and do what it does.
Absolutely. We want to get your brain chemistry back into a healthy space so that you can express yourself in a better way consistently and relearn those rational thought patterns over time. And that is just the nature of the beast, unfortunately. But boy, I tell you, it really works when we do the process and we trust the process. Of course, if you're having any side effects, you think something is not going right with the medicine, definitely let your provider know. That's what we're here for. Don't just stop a medication on your own. Always consult your provider.
There's no med for life problems. I don't know what that med is, but there are meds for symptoms. If you take the meds, you start seeing your symptoms go down. That's called improvement, and that's what you want. That's what Paul does in the form of prescribing. Now, this video is actually not intended for medical care, but Paul does intended medical care all the time. In fact, you can reach him if you call my office or if you call Paul's office. We'd love to help you.